Hello, everybody. This is Gary to December 26, 2021. It's 4:26 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Um, Today, my symptoms are pretty much under control. My auditory hallucinations are not that intense. They're there. They're always there. They're not that strong today. My paranoia is pretty much under control. My anxiety is under control. My depression, on the other hand, is a little bit severe today. When I get depressed, it's hard to cope and motivate myself to do things like keeping my apartment clean or simple things like doing my laundry, which I have to do soon. Depression sometimes robs you of motivation to do certain things, everyday things that have to get done sooner or later. My apartment's a little messy. It really could be cleaned up a bit. My clothes are all getting dirty. They really do need to be washed. If I don't do it tonight, I'll probably do it tomorrow. I did go out for a walk today for exercise. Um, I have a lot of physical pain in my legs. That may be due to the fact I haven't actually exercised in a very long time. And I started exercising again about 3 weeks ago. And I think my body's a little out of shape. Um, and it's hard to motivate myself to go outside for a walk when it's raining or snowing outside. Um, I live in Rochester, New York. In December, it's either very cold or rainy or snowing during the winter. Right now, it's more just very chilly out. It's not really snowing. But I did go out for a walk today because that actually helps with my depression. Physical exercise always helps with depression and anxiety. If I stay indoors all day by myself, not around other people, that will only aggravate my anxiety, my paranoia, even my hallucinations, and certainly my depression. Um, Yesterday, I had a weird experience. Earlier this year, I had to have surgery on my bladder because I couldn't urinate, and I was having difficulty urinating yesterday. And I was afraid that I would have to go to the emergency room and have a urinary catheter put back in, which I wore for 4 months during this past year. But it turns out that was not true. I was able to start urinating again. I'm not sure why I stopped, but it was difficult to urinate for 4 or 5 hours, which is a long time for me. Um, but I'm back to normal physically, so I didn't go to the medical emergency room. I almost did, but I wanted to make sure that there was something really wrong before I went to the hospital, and there really was nothing wrong. I probably wasn't just drinking enough fluids, therefore I wasn't urinating that much. I was probably dehydrated. Um, I live in fear of having to have a catheter put back in because I wore a urinary catheter with a urinary leg bag for 4 months, unable to go to the bathroom normally. I had surgery on my prostate because they thought maybe my prostate was blocking my urethra, so I couldn't urinate. And then they did a ultrasound of my urinary bladder, and it had what's called diverticuli in the bladder, which are sort of like swellings of like water balloons around the bladder holding the urine, and made it impossible for me to empty my bladder. And after the surgery, I was able to start urinating again. I just don't want that to have to happen again. And it doesn't look like it's going to. I will contact my primary care this week, either tomorrow or Tuesday, just to let them know what happened. Um, I will be seeing my psychiatrist in February. I know that's a faraway date, but I will be seeing my therapist once every 2 or 3 weeks. And also, I'm starting a new group on January 4th. It'll meet once a week at my mental health clinic that I go to, Strong Ties in Rochester, New York. Um, so I'll have a lot of support. Um, the goal being to be able to talk with and get support from other people with mental illness, not just my therapist, not just my psychiatrist, but other people who are actually dealing with their own version of mental illness, whether that's schizophrenia, schizoaffective disorder, bipolar disorder, borderline personality disorder, um, depression, anxiety, whatever it might be. Um, so it's important that I get support from other people with mental illness like myself and be able to get support for our symptoms from other people who have similar symptoms or even different symptoms. Um, Somebody just left a comment in the chat section. It was spam. I just removed it. Um, People can be real assholes sometimes, but that's part of being on YouTube, I guess. Um, but I will be seeing my therapist in about 2 weeks, starting group on January 4th. Sticking to my daily schedule, including my work, making these YouTube videos, exercising, meditating, keeping my apartment clean, going food shopping, just keeping up with daily life is important. Keeping a daily schedule is important in helping control your mental health symptoms. It certainly helps with me. Try to stay busy every day, and that's how I cope with most of my symptoms. Like, comment, share, subscribe.